Hi, my name's Andrew. I'm one of the final year medical students. Could I just confirm your name and date of birth, please?
Sure, it's James, 13th of December 1989.
Nice to meet you, James. Today I've been asked to examine your feet. This will involve me inspecting the feet, feeling pulses, and then assessing sensation. To complete the exam, I'll have you walk. Would that be okay?
Yeah, that's fine.
Do you have any pain anywhere?
No.
Great. James, I'm just going to start by inspecting your legs. I'm now going to assess sensation on your feet using the mono-filament. Can you feel this?
Yes.
Great. I'm going to touch various points on the sole of your feet in turn. I'd like you to close your eyes and let me know whether you can feel it by saying yes. Jim, so if you could just close your eyes and let me know whether you feel the mono-filament touch the sole of your foot.
Yes. 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 Yes.
Yeah. James, I'd now like to assess your walk. If you could walk to the far side of the room, turn around and walk back for me. James, I'm now going to assess vibration sense using this tuning fork. Can you feel this?
I can.
Great. James, I'd like you to close your eyes. Let me know whether you feel the tuning fork vibrating and when it stops vibrating.
I can feel that. It stopped.
And now the same on the other side.
Yeah, I can feel that. It stopped.
James, I'm now going to assess your joint position sense. This will involve me moving your big toe up or down. This is up, and this is down. Close your eyes and tell me whether I'm moving your toe up or down.
Down. Down. Up. Up. Down.
Same on the other side. James, I'm now going to assess the reflex at your ankle joint. I'd like you to bring your leg out to the side of the bed, like so. And the same on the other side. That's the end of the examination. Thank you very much. Today I performed a diabetic foot exam on James, a 29-year-old male. On inspection, he had no gross deformities or evidence of ulceration. On palpation, he had strong foot pulses bilaterally, and he had no sensory deficits on assessment with the monofilament. His gait was also normal. This was a normal diabetic foot exam. To complete my assessment, I would perform a full peripheral vascular exam and offer advice on good diabetic foot care.